Today, Houston became the first city to host a Children's AIDS Day conference. The purpose? To refocus our attention on the plight of children and families affected by this deadly disease. How have we dealt with this illness in the past? Why have medical advances led to a false sense of calm in today's teenagers? And what does the future hold for our children and families battling this modern-day plague? Tonight, Children and AIDS. I'm Ernie Manous, and this is Houston 8. Since the first reported AIDS case in the U.S. in 1981, at least 1.6 million people have been infected with HIV. Nearly 10,000 of these are children under the age of 13 who were infected around the time of birth. Even though the technology exists to end it, nearly 200 U.S. children are infected with HIV through mother-to-child transmission annually. This can occur at any point during pregnancy, labor, delivery, or through breast milk after the baby is born, which approximately doubles the risk of HIV transmission. From 2002 to 2006, the number of AIDS cases among children had decreased by 64%. But recently, that trend has reversed. Joining us tonight are Kristin Close, social worker specializing in HIV-positive children and families; Rod Castle, CEO and co-founder of the Osito Foundation and Children's AIDS Network; and Dr. Heidi Schwarzwald, Baylor International Pediatric AIDS Initiative. Welcome to all of you for joining us. First of all, congratulations on this conference. A great step in the right direction, I'm guessing. Rod, how did it all come about?
We started the Osito Foundation, which is the parent company of Children's AIDS Network, about 1.5 years ago, and we started with the desire to give children who have been impacted by HIV and AIDS a teddy bear. And when we use the word impacted, what we mean by that, often in the AIDS world organizations, you see infected or affected. And we didn't want to distinguish between just children who have been infected with HIV, but also there's many, many children as well who have been affected. Their mother has passed away or their mother has HIV, so we provide them teddy bears, and we started here in Houston, and we've done it around the country, and we've given out almost 5,000 teddy bears in our first year.
And the teddy bears are wonderful, but then you went the next step to this conference.
Absolutely. We saw that there's a greater need than just the teddy bear. We wanted to be able to provide social services and other needs that the children have, and so we decided that with launching the Children's AIDS Network in 2010, we did a lot of research and found that we didn't have a day that focused just on the children, and so February 12th has now become Children's AIDS Day.
Kristin, why is it important to refocus on the children? What do we miss in the way we are currently giving attention to this disease, and what's different when it goes for children?
I think a lot of the attention now is especially focused on adults, and a lot of attention is also focused overseas on the plight in Africa and people that are suffering in Africa because of lack of treatment and lack of access to treatment, and the high number of people infected overseas. And so we've lost focus not only on children but on people here in the States, and it's still a disease here that affects adults, teenagers, children, families all together as a unit. So I think it's really important to refocus because these kids are going to grow up into healthy, productive adults if we're able to give them the treatment and support they need right now.
You say they're going to grow up into healthy, productive adults. I'm sure a lot of people in our audience are saying, well, how can they? It's HIV-positive children, it's children with AIDS. How are they going to grow up to be healthy adults?
They're going to grow up to be healthy adults because we now have the medications available to make that happen. While there's a lot of focus on providing a cure, there's also a lot of focus on making medications easier to tolerate, easier to take, and extend lives well into productive adulthood. And so if we're able to reach these children at a young age and help them grow into healthy adolescents and then healthy adults, they can go to college, have jobs, get married, have children, and lead productive lives. But we have to be able to reach them when they're children.
Doctor, when we do talk about the treatments that are out there, and we talk about the difference between finding ways to live with AIDS and cure AIDS, how is that different research?
Well, finding a cure for AIDS has been extremely difficult because of the nature of the virus. The way that it works inside the body makes it incredibly complicated. What we have successfully done is find medications that treat it. So the same way we can't cure diabetes, we can't necessarily cure hypertension, but people can take medications and not have the complications of those diseases. That's really where we are with HIV today.
But then I'm nowhere near the study you have done in this area, but those medications then have their own set of problems. Aren't we, the olden days of this disease, people would talk about the treatments were almost as bad as the disease.
And they were in the old days, and thankfully the medications that we do have less and less of those side effects, and so are more and more palatable. The irony is that the children actually tolerate the medicines far better than the adults do.
Really?
They tend to have far less side effects than the adults, and I think that's very counterintuitive for some people. But
can you put someone on a program that's a child of these medications and honestly believe that they are going to make it completely to adulthood and through their adult years without issue?
I don't just have to believe it. I have patients who were infected as children and who are now in their mid-20s and are completing college and getting married and having families. But those are the kids who had that broader support in their lives. So family members that were supportive, a community that was supportive and enabled them to stay on their medications and do those things. And that's the piece I think that falls through for so many of our kids and their families.
And I want to open this up to all of you, and please feel free to interject as we go along here. But when we talk about this, I would think the biggest problem I've had with this whole thing is the education. People don't know that these treatments even exist. Even if you are HIV positive or have AIDS, you might still not have access to this information.
One of the things to kind of echo what Kristin and Heidi are talking about is the stigma effect that's associated with this disease. That's extremely important. The media attention that was once on HIV has disappeared because of the advent of the medication. Some people believe that it's a chronic disease like diabetes. But the growth is now coming back, and we're seeing it in a different segment. We're seeing it in a heterosexual segment in the community, in African American and minority women, and we're also seeing it in this 13 to 24-year-old category. So there's a whole new generation that's coming along that didn't see the fear. It didn't see the problems that we as adults saw 15, 20 years ago when 8,000 people a day were dying here in the United States.
And I think that's a wonderful point, because, and I'll come to you, Kristin, with this, is that all of a sudden it sounds like listening to the doctor talk, oh, there's hope, we can live a full, productive life. How do you put the message out there that, yes, there's hope, you can live a full life, but also this is still a killer disease? How do you balance that message going out and be truthful in what you're saying?
I think the important part is just educating them initially on transmission. I think a lot of the teenagers aren't learning about this in school. It's not talked about at home, and so they don't realize that this is a disease that you can't see it on someone when they walk past you on the street. They still have this old knowledge of, well, if someone has HIV, then that means they have AIDS, and they look skinny, and their hair is falling out, and they're really, really sick. They don't realize that people are walking around every day that are completely healthy and have HIV, and so they think that I'm protected because I'm heterosexual and this person looked healthy to me, and so I'm not at risk. And so I think it's really important to make sure they understand how they can get it. And while it's important to stress the message of hope, it's also important to stress the message that you don't even have to have this. You can prevent yourself from getting it completely and not worry about it if you take the right steps and protect yourself.
And I would think that the problem in all this is the balance between hope and the severity of what this disease is. We battle both. I'm a teenage kid. I hear you folks talking on TV, and I think to myself, all right, so I get it. There's medications to take. I'll be fine. Why should I cramp my style today, because of something that's not going to kill me? It's like diabetes. There's medicine. How do you get that message out there?
Well, I think that part of that message is out there for us already, and I think nobody wants to become HIV positive. Nobody's out there actively looking for that in their lives. And we say there are medications out there, and they're better than they were, but that doesn't make them perfect. Right. And I think all you have to do is ask any of our patients who take them whether they'd rather to be taking them or not taking them, and they will all tell you they'd rather not be taking them. And the longer you're on them, the more difficult they can become. But I think it speaks to a broader difficulty in society, is getting the message about sexuality and prevention out there anyway, because unfortunately so much of our society just doesn't want to talk about that at all with our young teenagers. And so whether it's HIV or chlamydia or gonorrhea or any of the other number of sexually transmitted infections, we need to talk to our teenagers openly about their sexuality and about the things they can do to protect themselves.
And I feel like I'm beating a dead horse on this one. I'm going to go at it one more time. Is that, I mean, I think in a group like this and at the conference and all that, you want to talk of the hope and the achievements and all of that.
Right.
But I worry that so much attention on the hope and the good deeds detracts from what the serious problem is that it's still out there. And as you said, the media attention isn't there like it used to be. And so how do you folks, all as a group together, have hope and congratulate yourselves on your accomplishments, yet at the same time let people know they shouldn't be celebrating yet?
I have a great story about that. I have a unique perspective of the disease because I get to travel across the country and I meet with executive directors of AIDS organizations in LA and Las Vegas and New York and Atlanta, different places across the country. And one of the things that I have noticed that when I go into these clinics and I see, the thing that catches me is that, and this is what your general audience doesn't get to see on the face of HIV. Now what I see in there is I see 40, 50, 60-year-old women who are heterosexual women that are sitting there getting treatment for HIV. That is one of the things that drives me and the Osito Foundation to do what we do, is because they should not be sitting there. And the message that has to get out is how do we protect these women? And part of the speakers that were at the conference today, they talk about issues like that. And one of the doctors, Dr. Gloria Jerez, who is from Argentina, told me recently that she had 3 Latino women that recently just died of HIV because they chose not to take the medication because of the stigma, again, associated with the disease. The cure, in a sense, is there that they're able to live healthy lives, but they chose not to take medication because of the stigma. So again, the message has to continue to be brought as many ways as we possibly can get it out there, that this is not a fun disease to have. This is not an easy path to take once you become positive. So we have to keep the message in many different ways to get it to the people.
And I'm going to guess, in addition to maybe the stigma of taking the medication, a lot of places it's the cost of the medication stands in people's way. True, false, still a problem?
Absolutely, the cost is an issue. There are some government programs that help cover the medication, but if you are undocumented, then that's not necessarily going to be open to you. Sometimes if you have health insurance, it's almost worse because of your high copays that you're going to have for the medication. So it's definitely a financial burden.
I want to talk, since the focus here should be on children, that's what we're talking about today, and the fact, even in our piece to start with, that the transmission that happens between mother and infant through either breast milk or through the process of birthing, it doesn't have to be. And I think a lot of people would be fascinated by that fact alone. Explain why.
So one of the most exciting things that's ever happened in HIV research is that we discovered that by giving pregnant women the same sort of cocktail of medications that anyone who's infected takes throughout her pregnancy, deliver the baby safely, and then mom chooses not to breastfeed, we can basically completely eliminate transition. And so there is actually, so when we talk about 200 cases in the U.S. in a year, in my mind, that is 200 too many. It should be 0. Because we have the technology to prevent it. And again, it goes back to, though, community support and making sure that women are getting tested during their pregnancies, making sure that women understand they need to be tested multiple times during their pregnancies, and getting these women into care. So often the women whose children are infected are the women who are disenfranchised for other reasons and aren't in any kind of
How
care.
early in the process does the mother have to start taking the cocktail before it has an effect on the child?
Ideally, she'd start in the 2nd trimester, but even starting in the 3rd trimester, or even just
can have
a positive effect. Even if she just gets it at delivery, that can reduce it. Yeah.
So in my mind, it would be that aren't the mother fluids and the baby fluids, they are totally separate. We are not sharing blood with the baby at that time?
There is some sharing, but it's relatively limited. So most of your infections actually take place during the process of delivery. when the baby's being exposed to a great deal of the mother's fluids. And so it's never too late for some preventions. For a few babies, sometimes it's too late, but for most babies, it's never too late to start prevention. So it's never too late in a pregnancy to get tested.
And then I'm assuming HIV is present in breast milk, and that's why
Correct.
we're talking about that also. So if they
Right.
choose not to breastfeed, that's, of course, a better thing. If a mother feels that she must breastfeed her child, if she's in a place, is there anything that can help with that if the mother is HIV positive?
Absolutely. So outside of the United States, where we don't have organizations that can provide safe alternative feeding like formula or other things, then the women will breastfeed and will leave them on the medications while they're breastfeeding. And there are some new, very exciting studies that have shown that you can't make it zero, the transmission, but you can reduce it enormously if mom remains on the medications.
A question also I have about this in broader is when people take the drugs that are available today and their viral load is down to zero or that's non-detectable, are those people still able to transmit the disease? Is that a misnomer that we think if it's zero load, then it's less chance of spreading, or how does that work?
So we can never say never, but certainly the lower your viral load, the less likely you are to transmit.
Undetectable does not mean zero. So the tests that are performed, they only go down to a certain threshold. So it could be 100 copies of the virus or 48 copies of the virus, which means that undetectable means simply less than 48 copies. So that person could have 47 copies, could have 10 copies, but undetectable doesn't equal 0 copies.
Now, another thing that came up to me when getting ready for this particular show, which struck me as odd that I'd never thought of it before, children that are born to parents that are HIV positive have a good chance of not seeing that parent for the duration of their life, that the parent is going to be taken away from them sooner. And I never thought about that added stress that's on these children that are probably born HIV positive. All of a sudden their parent is dealing with a life-threatening illness. What do you find in your work when it hits that area?
We find that a lot of our children are growing up without their mom or their father because especially our young teenagers and older teenagers who were born with this disease 13, 14, 15 years ago when treatments weren't as good, weren't as available, and so their parents didn't survive their battle with HIV and AIDS, and so a good number of the patients we work with are being raised in kinship care, so they're being raised by aunts, uncles, grandparents, cousins, sometimes a neighbor that stepped in and took on that role. And so you have this teenager that's coming of age that's, trying to figure out who they are and also figure out, how much does their disease label who they are as a person, and then they don't have that mom or dad there to also guide them through this process, and they also are thinking, what killed my mom could also kill me. So there's all these layers of issues that these teenagers are trying to work through at the same time as being a 15-year-old teenager, and so regular teen issues. And so it's really adds a lot of stress. And so we really try to help them through that and help get them into therapy just because they've got so much that they're trying to process as they become the adult version of themselves.
I'm guessing add into the mix, too, people who know that they're HIV positive pulling away also, that lack of comfort that we all have in everyday life, someone who's HIV positive and the word is out. I'm sure there's still that idea in the community, to stay away, don't get too close.
Well, and because of that, most of our teenagers don't disclose their status to their friends, their church, their school. Most people have no idea that they're going through this. Even best friends will have no idea. I spoke with a 16-year-old patient of mine, and he's a boy, and I asked him if he had told any of his best friends, and he said, well, no, but how do I say that? Like, hey, how's the football game? By the way, I have HIV. He's like, how do I fit that into the conversation? And what if they don't understand? And so there's just, most of the time, these teenagers are working through this, and no one even knows.
So I am guessing the majority of our audience does not have HIV. And they're watching saying, but it doesn't affect me. Why should I care about this? It's going to be that. Explain why all of our viewers need to care about this. And all of you have a shot at it. I'll start with you.
Because it could be you. Everyone should get tested. It could be the person walking next to you on the street. Everyone could be exposed to the virus, and it could help. I mean, this could be your friends, your family members, or could be neighbors that you have no idea have the disease. And I think everyone assumes, like I said earlier, well, if they look healthy, then, and they don't fit at this preset category of being a gay man or a drug user like they described it in the 80s, then they can't have it. But those are out the window now. That's not the way it is anymore. And so everyone thinks, well, this isn't me, but it could be. Our patients are all over Houston in all different neighborhoods, and so I think it's important to say that, this isn't me, but it could be infecting your life, and you just don't know it.
Lady Gaga and Cyndi Lauper were on a morning show yesterday out of New York, and they're working with MAC Cosmetic, and they were talking about it, that Lady Gaga, I assume, is in her early 20s. Cyndi Lauper's, 40.
Not.
Yeah, not. But they were speaking about that, and there's a new program they're working on to distribute female condoms, because Lady Gaga and Cyndi Lauper were saying, we're the demographic now of HIV, and we need to know about it, and we need to protect ourselves. So when we have people at that level talking about it, we need to be talking about it on a local level as well.
But talk about a little bit when you come into a community that doesn't understand. What are we having to educate them about when we talk about pediatric AIDS or children with AIDS?
Well, I think there's so many things to educate them about. One is that it's still out there. Two is that babies born to HIV-positive moms don't have to be positive. I think a lot of people don't realize that. Even some of the HIV-positive women themselves don't realize that. And then getting the communities to embrace these families instead of ostracizing them, getting the churches and the communities to allow the children to be open about it without the ostracize. It always strikes me when churches rally around a child with other illnesses, so the child with cancer, and everybody comes and raises money and helps support the family. And these days, cancer is a relatively short term, right? Many of the cancer kids after a year or two are cured, and that's fantastic and thankful. And not to belittle everything that's done for them, but I always think, and my poor HIV patients, nobody rallies to them. Mm-hmm. Nobody's there to support their family through what's oftentimes a much, much longer road.
Long ago, I made a promise to myself, if ever we cover this topic, and whenever we do cover it, that we will talk about safe sex guidelines and understanding exposure and how this disease really is transmitted and isn't. In a minute, what can you tell me?
So, sexual fluids, semen, vaginal fluid, blood, breast milk. I mean, those are kind of your main ways. Prevention is using a condom, is one way to prevent. We talk about the ABCs, so abstinence, choosing not to have sex at all. That's one way to prevent it. Being faithful, so knowing your partners, getting tested, having one partner at a time, and then using a condom.
Yeah. Hugging someone, grabbing them, giving a kiss on the cheek. None of that is good. If you come across a child that's HIV positive, you can hug that child. You can roughhouse with that child. It's still safe.
Yeah. Hugging, eating off the plate after them, sharing a fork, sharing a glass, tears, none of these things are going to transmit.
Yeah. Kristin, what do you think we should be doing now? Where should our focus be?
For me, so much of my work when I started almost 7 years ago, I had a lot of kids that were, between 5 and 10, and they were just trying to get through school and take their meds and listen to their caregivers, and now they're all teenagers. And so all those issues I was describing earlier, for me, our focus is really on supporting the adolescents, because not only from the perspective of the adolescents that are already infected and have this host of issues and are being ostracized and can't get support from friends, family, church, school, but also that's our fastest growing population too, are these adolescents that don't know they're at risk and are getting infected with a disease that they don't have to get infected with, that doesn't have to become something that they have to deal with the rest of their lives.
I'm getting a 2-minute warning from my control room, and I want to make sure I hit this one question before we go off the air, is that we talked at the very beginning piece that transmission rates had gone down, and now they're going back up. And I'm curious, why has that happened?
It becomes to where the disease has headed. So our new infections are oftentimes among minority women. They're oftentimes among people who are disenfranchised, and so who are not getting the prenatal care and are not getting tested. Actually, on January 1st, Texas changed the laws so that pregnant women are now getting tested at the first trimester and at the third trimester. They used to only get tested at the first trimester and at delivery, and we had enough moms who were becoming HIV positive during their pregnancies that we were missing those, and those are many of the babies that we were seeing that were infected. But it's bringing that last pocket of women who don't feel like the healthcare system is available to them into the fold and letting them know that it's worthwhile getting tested during your pregnancy because we can prevent transmission, and that's how to get the numbers back down where they should be.
So educate people, make sure you're getting tested regularly. If you are pregnant, definitely get tested.
Twice.
And get tested twice. And you can, just because you might have, and I hate to use this term, you might have this curse, doesn't mean you have to pass it on to your child.
Exactly.
Correct? Thank you all so much for coming in and for the good work that you all have been doing. Will there be another conference?
We have our next one's coming up in Atlanta in May.
Well, thank you for all the hard work you're doing. Thank you for joining us. Now, each week we invite you to visit our home online at HoustonPBS.org. Simply click on the local programs bar, pick Houston 8, and you can join our online community. Read about the guests, learn more about the topic, share your thoughts and ideas, and even suggest questions we might ask during upcoming episodes. Remember, information posted on our website may be used on air, so keep that in mind when submitting. That does it for us tonight. Until next time, I'm Ernie Manous. Thank you for joining us. Have a great week. Bye-bye.